Have you ever wondered why, in an age of incredible medical breakthroughs, a disease as old as malaria still claims hundreds of thousands of lives every year, mostly in Africa? It's a question that keeps scientists, doctors, and policymakers up at night. But the answer isn't just about science, it's deeply tangled in the world of politics, economics, and global power. Today, we're diving deep into the politics of malaria vaccine production in Africa. For over a century, the world has been searching for a silver bullet against malaria. Finally, after decades of relentless research, we have not one, but two approved vaccines, RTS, S and R21. This is monumental. It's a testament to human ingenuity and collaboration. You'd think the story ends there, right? Vaccines are here, problem solved. But this is where the plot thickens. The real challenge isn't just inventing a vaccine, it's about making it, distributing it, and getting it into the arms of the children who need it most. And that's a political minefield. Let's start with the big picture. Historically, Africa has been overwhelmingly dependent on imported medicines and vaccines. Over 99% of vaccines used on the continent are manufactured elsewhere. This isn't just a statistic, it's a critical vulnerability. When a global crisis hits, like the COVID-19 pandemic, this dependency becomes painfully clear. We all saw what happened. Wealthier nations prioritized their own populations, and Africa was often left at the back of the queue. This experience was a harsh wake-up call, sparking a powerful movement across the continent for vaccine sovereignty. African leaders and scientists are saying, never again. We need to control our own health security. This brings us to the malaria vaccine. The demand is enormous. Gavi, the Vaccine Alliance, estimates that at least 40 to 60 million doses will be needed annually by 2026. And that number could jump to 100 million doses by 2030. The first vaccine, RTS-S, is produced by a single company, GSK in Europe. While they've made incredible efforts, their production capacity is limited. They've partnered with India's Bharat Biotech to scale up, but even then, it's not enough to meet the staggering demand. It's simple math: limited supply plus massive demand equals a heartbreaking shortfall. Millions of children are left unprotected. Now, enter the second vaccine, R21, developed by the University of Oxford and manufactured by the Serum Institute of India, the largest vaccine manufacturer in the world. This was a game changer. The Serum Institute has the capacity to produce over 100 million doses a year. And at a much lower cost. More vaccines, cheaper prices. This is fantastic news. But it also introduces a new layer of complexity. Now we have different products, different supply chains, and different political and economic interests at play. The dream, of course, is to produce these vaccines in Africa, for Africa. And this is where the political drama really unfolds. Several African nations, like Ghana, Senegal, and Rwanda, have been actively pushing to build their own vaccine manufacturing facilities. It's a bold and necessary ambition. But building a state-of-the-art vaccine plant isn't like setting up a simple factory. It requires billions in investment, highly specialized technology, a skilled workforce, and, most importantly, a complex process called tech transfer. Tech transfer is essentially the recipe book. The original developer, like GSK or Oxford, has to share its secret sauce, the exact, highly guarded process for making the vaccine safely and effectively. This is where politics and business collide. Pharmaceutical companies have invested billions and decades into developing these products. Handing over their intellectual property is a huge deal. They need assurances that their technology will be protected and that the new facilities can meet incredibly strict quality and safety standards. Negotiating these tech transfer agreements is a high-stakes diplomatic dance. It involves governments, international health organizations like the WHO, funding bodies like Gavi, and the pharmaceutical companies themselves. Everyone has a different priority. Governments want self-sufficiency and jobs. Health organizations want equitable access. And companies want to protect their investments and reputation. Finding a solution that satisfies everyone is incredibly difficult. Let's look at Ghana, for example. The nation is poised to be a leader in this space. They're working on a fill and finish facility, which is the final step in the vaccine production process, putting the vaccine into vials and packaging it. This is a crucial first step toward full-scale manufacturing. But even this requires navigating a maze of international regulations and securing agreements with the patent holders. It's a slow, painstaking process. Then there's the money. Who pays for all this? Building these facilities costs a fortune. African governments are stepping up, but they can't do it alone. They need support from international partners like the World Bank, the European Union, and philanthropic foundations. This funding often comes with strings attached, influencing which technologies are chosen and which countries get prioritized. It creates a competitive environment where nations are vying for limited resources. Sometimes hindering continent-wide collaboration, the African Union is trying to coordinate these efforts, promoting a unified strategy, but national interests can sometimes get in the way. Another political dimension is the regulatory landscape. Each country has its own drug regulatory agency, like the FDA in the United States. For a vaccine to be used, it must be approved by these national bodies. Historically, this has been a slow process. To speed things up, the African Union has been working to harmonize these regulations and strengthen the African Medicines Agency (EMA). A strong unified EMA would mean that a vaccine approved by them could be rolled out much faster across the continent. But getting every member state to cede some of its regulatory sovereignty to a continental body is, you guessed it, a major political challenge. So, where does this leave us? We're at a pivotal moment. The political will for vaccine manufacturing in Africa has never been stronger. The COVID-19 pandemic, while devastating, created an unstoppable momentum. We have the scientific breakthroughs with RTS, and R21. We have African nations stepping up, and international partners showing support. But the path forward is not a straight line. It's a winding road filled with political negotiations, economic hurdles, and complex power dynamics. The success of malaria vaccine production in Africa will be the ultimate test of global cooperation. It requires pharmaceutical giants to think beyond pure profit and embrace a more equitable model of global health. It requires wealthy nations to invest not just money, but trust in Africa's capacity to innovate and lead. And it requires African leaders to work together, putting continental solidarity above narrow national interests. The lives of millions of children hang in the balance. This isn't just about factories and patents, it's about justice. It's about ending a centuries-old scourge and giving every child in Africa the chance to grow up healthy and fulfill their potential. The science has given us the tools. Now, it's up to our politics to deliver on that promise. Thank you so much for watching. This is a complex but incredibly important topic, and raising awareness is the first step. If you found this video insightful, please give it a thumbs up. And consider subscribing for more deep dives into the issues shaping our world. We'd love to hear your thoughts in the comments below. See you next time.